观众朋友们，大家好，欢迎您收看今天的健康1+1节目。在生活繁忙的今天，人们整天就是工作、家庭，真的是蜡烛两头烧。即使知道健康的重要，却总是无意中忽略了。等到发现的时候，可能已经到了很难以挽救的地步。如果这种情况不幸发生，我们应该怎么样对待呢？在本期的节目中，我们将帮助晚期前列腺癌病患了解晚期前列腺癌的常见症状、治疗方法、养护措施以及克服心理障碍的方法。首先呢，我们先了解一下晚期前列腺癌的一些常见症状和前列腺癌患者的心理表现。一般情况下，晚期前列腺癌病人会出现排尿障碍，80%的病人会有排尿困难、尿分叉以及尿程延长、尿频、尿急、尿痛、尿液不尽等症状，而且转移症状是常见的，多发生在骨骼内外、腰部以及腹股沟等部位，引起相应部位的淋巴结肿大以及下肢肿胀。
Advanced prostate cancer is really cancer that has spread from the prostate in your pelvis to other parts of the body. The most common symptoms of advanced prostate cancer are bone pain, and that's because prostate cancer most commonly goes to bone in about 90% of patients who have advanced prostate cancer.
由于癌转移出现的疼痛，腰部、臀部、髋部疼痛、骨盆、坐骨神经痛是常见的症状，剧痛难忍。由于疼痛影响饮食、睡眠和精神，长期的折磨会使全身状况日渐虚弱、消瘦乏力，甚至导致进行性贫血、恶病质以及肾功能衰竭。对于不同文化背景的任何人，当听到你得了癌症时，心理上肯定会感到压力，想到死亡和对死亡的恐惧。很多情况下，当男士面对前列腺癌时，也会有类似的情况。
I was in the middle of two very important professional projects for me, and I went to a urologist. He performed an examination and isolated and requested a biopsy.Actually, and the biopsy came back positive for cancer. It was prostate cancer. I was stunned and sad and anxious. Everything on the surface may have looked normal, but I knew that inside I was definitely going through changes. And it was frightening to me, honestly. There was a lot of anxiety and fear.Men
carry a heavy burden, almost across all cultures, of being the one to take care of family. So the last thing they want to do is burden family with their own concerns as well. And oftentimes they don't have the strength or the wherewithal to continue their financial contributions. So within that, the psychological stress for patients especially isn't just about the cancer.About mortality, about pain, about relationships with their doctors. It's also about not being able to work, about what's going to happen to the family if they can't provide, about all of those other issues.
前列腺癌跟肺癌啊、肝癌啊，确实有一点不同，因为我们知道前列腺是男性的一个生殖器，病患者呢在性功能方面会受到影响，而且呢他本身的病会比较痛。那他的痛也会影响他的情绪。
在对前列腺癌患者的心理状况和对晚期前列腺癌的常见症状了解后，我们将给大家介绍的是治疗方法。首先，准确的诊断可以帮助医生找出最佳的治疗方案。那么，目前对于晚期前列腺癌的诊断方法都有哪些呢
For early prostate cancer, we know that blood tests like PSA may detect the cancer early, and those patients may be treated with treatments like surgery or radiation. But once prostate cancer spreads beyond the prostate, tests like PSA are not enough. You need to assess whether or not the cancer has spread to other parts of the body. And those tests include a test called the bone scan, where we look at the entire body's bones because prostate cancer commonly goes to bone in about 90% of cases. We also do something called a CAT scan of the abdomen and pelvis, and the CAT scan would look for other sites where cancer can spread, including the lymph nodes and the liver and possibly the lungs. Those tests help us to know where the cancer is and also help us to know what the best treatments might be for advanced prostate cancer.
另一个检测手法就是肛门指诊，检查者戴上手套，涂上润滑剂，将手指伸入肛门内的直肠检查前列腺的大小、形状与质地。形状不规则，质地硬或软，可能是肿瘤，需进一步检查。这个检查只检查前列腺的背面，不过85%前列腺癌是发生在此区，能在肛门指检中摸出来的癌症通常更为严重。
Most men don't want a prostate exam. You know, it's not a pleasant experience to go to your doctor's office and to have the doctor do a digital exam of your prostate. On the other hand, it's a very simple test, and it can pick up a cancer really early. So in general, it's after the age of 50, you should consider having a regular examination, a physical examination that includes a digital rectal exam.